Hey, welcome to the Better Wounds podcast. We'll be diving into the sometimes complicated healing journey after plastic surgery. I am your host, Heather Flexer, a dedicated wound care specialist with a passion for guiding individuals through the intricate process of wound healing. So, we're chatting today about MythBusters because there's so much out there on how you are supposed to heal your wounds. And some of it and some of the recommendations that you're following are like urban legends. And they may send you down the wrong path. So I want to chat about it and try to clear some up. So if you've been following me on social media or anything like that, you might have seen these already. But this will give me a little bit more chance to kind of talk about them a little bit more. So one of the biggest ones, hopefully you can see the graphic, is that winds need air. Now, that isn't necessarily true. In general, it's been proven that moist wound healing, keeping something covered essentially, allows for faster healing. So, the idea that you need to leave it open to air is going to be counterintuitive to that. So, they found that the cells migrate faster, the body heals faster when that wound is covered, and the body temperature is kept the same. When we take the bandage off or we leave it open to air, those cells cool down, and that everything starts moving a lot slower. Plus, if it's open to air, it's going to dry out, and dried, scabbed over kind of open wounds are not necessarily the way to go if we're talking about a large, like an actual wound. If you're talking about your incision and it's closed, that's a different scenario. That is supposed to stay dry, and you're really just supposed to protect it. You don't want to start putting ointments on it because that can cause an issue. We're talking about wounds, not incisions. So if your incision opens up, if your lipoburn, the thick covering the burn comes off, now we need to switch gears, and now we need to get into moist wound healing. So obviously that's confusing, right? Even within the medical community, there's confusion there. So if you're not in the medical community, if this is all new to you, if you've just had surgery and you have this wound, of course it's confusing. So in general, keeping something covered is going to help it heal faster. Part of that is that it is going to moisturize and help debride, autolytic debride any bacteria, allow for wound healing. Understandably, some of you decide to cover the wound or leave the wound open to air when you cover it and you feel like it gets goopy or there's more drainage. But that's essentially because you are now doing autolytic debridement. The wound is going to produce a little bit more fluid. That just means it's time to switch potentially the dressings that you're using and use more absorptive products if a lot of fluid is being used. That also may be an indication that there's a little bacteria growing in there if it's getting goopy. So we're always monitoring these symptoms. If you do a consult with me, that's one of the first things I ask you is, one, to send a picture, and two, what are you doing? Because I can tell a lot by the picture, and then it really depends on what is going on and what you're using. So lots to play around with. But to heal a wound as fast as possible, we're talking more keeping it covered. Let's see, I'm using new technology here, so I'm trying to figure out how to use it. Thank you for playing along. Okay, so is compression bad for wounds? Too tight is going to cause restriction of blood flow. We need blood flow. That's where all the good healing nutrients come from. So we don't want to restrict blood flow. So if it's too tight, you have the potential to cause a lack of blood flow and tissue ischemia. meaning that you're cutting off the blood supply to the tissue. Of course, your wound is not going to heal if you cut off blood supply. But in general, mild compression is actually going to be good, because for many of you that are having liposuction, tummy tucks, things like that, they introduce fluid to your body during the procedure to make it go easier. And that interstitial fluid, the fluid that's in between the space of the cells, kind of stays in there. We need to obviously kind of encourage it to come out. But then it's just a normal trauma response that you cause a wound, they cut you, and your body's response is to flood the area with nutrients. It gets there by the blood supply, and the lymphatic system is supposed to clean it out. So part of the healing process is inflammation. So you're going to be inflamed immediately after surgery. Compression can help prevent that from being like out of control inflammation. So some mild compression is actually going to be good to support the body. Most people feel like it helps them move a little better, makes them feel more secure, that they're not going to like rip their incisions apart. It helps kind of restrict your movement a little bit so that you can't do these crazy things, and that is actually a good thing. Now, should you use it if a wound opens up? It's probably okay. You just want to make sure it's not too tight. And how do we know if it's too tight? If the wound starts looking worse, it's too tight. If you're having a hard time breathing, it's too tight. If you're only putting compression like in the middle, like only wearing the waist trainer, that's not a great idea. You actually want more uniform compression. So more of the full body situation, faja, will be better. If you're someone that tends to swell in the lower extremities, you probably want to also incorporate some garment that's going to include the lower extremities. So either full length legs, or you're also adding in like knee-high compression socks. That may help as well. So the compression is there to support your lymphatic system and kind of prevent things from going sideways. So even if you have a wound, it's not necessarily the worst. Do you want to squeeze the heck out of it? Do you want to be worried about, getting in that super tight stage 2 or 3 garment? No, that's not the time for this. But wearing a garment is not a bad idea. So it can help you for sure. Let's move to the next. So, will your wound take months to heal? It really depends on how big it is. So the bigger it is, the deeper it is, the more extensive it goes down into deeper tissues. If there's necrotic tissue, if there's an infection, those wounds may take months to heal. But often what I'm finding is that using kind of substandard wound care along with a pretty significant wound could make it take longer. So the idea here is address the wound. In wound care, we have certain products, certain protocols. We're always letting the wound kind of dictate what's being used. The thing you start with your wound is not going to be the same thing that you end with your product use. So there's going to be a change as things progress. There are things that you can do to make it better. Using advanced dressings is going to help. Gauze and saline and wet to dry, those are not advanced products. So if you're going somewhere and they're like, oh, that you just use wet to dry, it's going to take a few months. There's a reason, because wet to dry has been proven to cause chronic wounds. There's research about it. You can look it up. I might post one in the show notes now that I think about it, so keep an eye out for that. But wet to dry is not advanced wound care. Wet to dry is like ancient. It's cheap. That's why it's still used. But if you have necrotic tissue, getting a debridement, getting that necrotic tissue removed. It's dead. It's not coming back. It needs to be removed. That's how these things work. Getting debridement is going to help. Using adequate nutrition is going to help. You probably need more nutrition than you think, nutritional support than you think. So getting with a nutritionist is great. If you need someone, I have one. I will link her below. She actually has just come out with a new supplement, so I'll link that below as well. But getting good nutrition is going to help. Using advanced dressings is going to help. So if you don't know what's going on, if you feel like you're not getting anything else besides just watch it, just watch it, just watch it, that's usually when and how people kind of thing out together. So is your surgeon going to be the one to heal it? No, your body is going to heal it. Your surgeons did your surgery. You lived through the surgery. They're usually pretty happy that everything is good. They're in general not terribly concerned with the wounds because they know they'll heal. They also know that revisions can be done on the scar depending on how they look. So they don't seem, obviously they don't want you to have a wound complication like this, but in general it seems like they're not terribly concerned. And once like the wound sort of stabilizes, so they can tell it's not going to get a lot worse, that you seem to be healing, it may be slow, they seem relatively unbothered by it, at least from outward appearances. So it's not your surgeon that's going to heal your wound, it's your body. So everything that you do in between your appointments, whether you're working with your surgeon, you're working with a wound clinic, you're working with your post-op care provider, everything that you do in between your appointments is really going to make a huge difference in how your body heals. So, like I said, I have a nutritionist friend, Kylie Amanda. I think she's on social media at this point as Sulinu. I could probably look that up. But she just came out with a brand new supplement. You can check that out. I usually find that a lot of people are, trying to do the right thing. You want to get as much nutrition as possible. You want to get the nutrients. You want to get the food. It's got to come. Food is so important. So making sure you're getting lots of protein, lots of water. You heard that 100 times. But you also need to support the body with amino acids, and collagen helps. All these things that your body uses to grow new tissue need to making sure you get the nutrients, but also moving your body is helpful in order to support your tissue from growing, right? We need advanced products, we need nutrition, and we need to move. We need to support the circulatory system, we need to support the lymphatic system. So moving your body is going to help promote wound healing, even though it may not necessarily be the thing that you want to do. Even right out of surgery, we're recommending that people at least walk a little bit in their house. You want to get up, you want to use the bathroom, you want to take a walk to the kitchen once you start feeling good. If it's nice out, fresh air, get some sunshine, get moving a little bit. Just you're doing things within reason, so don't go overly crazy. Everyone's starting point is a little different, so it's difficult to say, like, this is the amount of mileage you need to do, this is the amount of exercise you need to do. It's just that you need to be moving, and the movement will help support your tissue. So I hope I've helped with a few myths today. I'd love to hear if you have any questions. You can drop them in the comments. Please subscribe, leave me a 5-star review, leave your comments, leave your questions. If you have other things you would like to discuss, please let me know. That'll help get this out there. I hope to start doing some interviews soon. And if you're in need of help, you're at home and this kind of got your mind going and thinking, oh, I keep getting told the same thing, I need help, then I offer personalized video consults. for folks that are managing these wounds at home, whether it's on you or you're a caregiver of someone, or you are a post-op care provider and you're seeing your clients and you're like, oh, this isn't really getting better. I need to help them. You can send them my way. This is a great opportunity for someone to just chat with a wound care specialist and get some personalized guidance on what to do next. So I do that all the time. You can feel free to refer someone. You can grab your consult today. Go to betterwounds.com/shop. You'll see the video consults as that first option. And you can use code podcast